Hi guys, my name is Dr. Crystal Aguh and welcome to the Curly Hair Bootcamp series. So this is the first lecture in the Curly Hair Bootcamp series and I'm so glad that you were able to join me. So if you have found this series, you probably are familiar with either my social media page, maybe you've come to my website and read some of my blog posts, perhaps you've read my book. But I always want to start off just by introducing myself so you just learn a little bit about me. So I am currently serving as an associate professor of dermatology at Johns Hopkins School of Medicine, where I also direct the ethnic skin program there. And I have a personal interest in hair loss, particularly scarring hair loss, especially in women of color. But I've written two books on hair. So I've written a textbook for dermatologists, and I've also written a hair care guide that, again, several of you may have already read. I've been so fortunate to have my research supported by multiple organizations, the Dermatology Foundation, the Skin of Color Society, as well as the NIH. So let's get started. So you can see here some of the books that I've written, and really the book on the right, 90 Days to Beautiful Hair, that's going to be a book that really covers a lot of what we talk about during our bootcamp series, but the bootcamp series is much more in depth, right? So the book, I give a lot of hair care tips. So if you have not read it, I encourage you to do so. But with this series, I'm really trying to approach and reach dermatologists and hair care stylists and people who have a deep, passionate interest in understanding the science behind curly hair in a way that I'm not able to do in a book format. And so why did I start this curly hair boot camp? Well, for starters, I've had my own personal struggles with hair loss, okay? So I grew up very tightly curled hair. Not only did I not know how to take care of my hair, I had a very hard time finding people who could help me understand how to take care of my hair. I certainly could find stylists that I'd go to, and if they were great, you know, I love what they would do with my hair, but I'd get home and I didn't know what else to do from there, right? I was afraid to wash my hair after it had already been styled because I just didn't want it to break and I didn't know how to handle it. And so that started a lot of my interest in understanding curly hair. But certainly, I will say that this is really kind of a niche area within dermatology. So we are the hair, skin, and nails experts. But even within our fields, there are very few dermatologists who really understand curly hair care. But I will tell you, there are a lot that want to, and I give talks around the country on this topic, and it's really become the most popular lecture topic that I give, right? I talk about my research, and then I also talk about curly hair care, and dermatologists have come to love it. And so I've been thinking about how to expand my reach to people not just in Maryland, not just in the United States, but internationally as well. And part of this stems from the fact that, yes, I see patients and I love my patients, but I can only see so many patients in my clinical practice in the state of Maryland, right? And there are people who need help everywhere. I get emails from women from the United Kingdom, from Australia, from South America, just asking if there's any way that I could pass off information to their dermatologist so they could figure out a way to counsel them on some of these issues. And so I really thought that the Curly Bootcamp series is going to allow me to do a deep dive into this topic, hopefully to help train other people or even train patients to be able to understand these issues and discuss them with the professionals that they work with. And lastly, of course, I've always loved the idea of empowering women. Okay, there was the old school way of medicine where we thought that, you know, you go to a doctor, the doctor tells you what to do, they don't explain to you why, you just do it, right? You just have faith in them and you just know that, you know, you're going to trust them no matter what they say. But I think it's very important that we work as a team, right? I think when we talk about the patient-doctor relationship in a dermatologist office or the client-stylist relationship, this really should be a partnership. And I want people to feel like they own this information, like they're able to make decisions about their own needs and their own health needs, and especially their hair needs, and can customize any kind of regimen that they develop for themselves in partnership with whatever professional that they're working with. So I just want to pass that power onto women. And it's the reason I wrote the book. And it's certainly one of the main reasons that I'm doing the Curly Hair Bootcamp series today. So let's start. So this quote is really the background that really supports the entire bootcamp series. So you can give a man a fish and he eats for a day, or you can teach a man to fish and he eats for a lifetime. You know, I joke with patients sometimes. I say, you know, I could probably put my name on a bottle of baby lotion and call it Dr. Aguh's magic hair serum, and I can make a ton of money. Right? And people would buy it and people would just say, okay, I'm just going to use what Dr. Aguh says. But that's not my goal. I don't want to do that. Right? There are great hair products that are already out on the market. I want to teach you to be able to identify what works best for you. I want to give you the knowledge. And once you have knowledge, you can apply that knowledge for the rest of your life. Right? Once you have that knowledge, you don't have to come back to me for that. I am not the gatekeeper of this information. I've done my best to pull it together from a variety of sources, a lot of scientific studies, but I want to hand it off to you and I want you to go from there. And I want you to be able to pass this information to your niece or your daughter or your cousin or your best friend or your coworker and on from there. Okay. So we'll start with some commonly asked questions that I hear in my clinical practice, because this is going to help you understand some of the topics that we're going to cover in this Curly Hair Bootcamp series. So to start, this is a very popular question. So I'll have women who come in and they'll say, you know, when I was younger, I had a lot of hair breakage when I was relaxed. And so I stopped relaxer, but my hair's still breaking. Like, you know, what gives? Okay, this is a great question. I think there's this misconception that relaxer is the only damaging hairstyling practice that's out there. And that's just simply not true. In fact, you can have healthy relaxed hair just like you can have healthy natural hair, but both of them have to be taken care of in the right way. And so you need those tools to understand what a hair regimen should look like and to be able to devise it yourself. But it's not, you know, going from relaxed to natural is not a cure-all, right? And depending on your hair type, it may make things harder. So we'll talk about that in detail in this bootcamp series. Another question I get is, how often should I wash my hair? And is co-washing helpful? Well, I think you guys would be surprised to hear my answer on this question, especially as it pertains to co-washing. But you'll see in one of my first lectures, the first course in this series, we'll talk about the science of hair care. And then in later lectures, we'll talk about products and we'll talk about how to incorporate shampooing, conditioning, deep conditioning into your regimen. And you'll get a sense as to why co-washing may or may not be a necessary part of your regimen. But certainly figuring out how many times a week that you wash is absolutely one of the major components of any healthy hair routine. Okay, so what about this one? So, you know, I used to notice my hair grow a lot in protective styles, but I'm not getting those results anymore. In fact, it seems like my hair's even thinner when I take it out of a protective style. So you think it's my thyroid? You know, maybe it's my iron levels. I could add a bunch of stuff to that, right? Maybe it's my vitamin D. Should we check my zinc? These are all good questions, but the answer to this question rarely is a result of your iron, your thyroid, your vitamin D, or whatever other blood work you want to check. And really what this question gets to is how hair changes over time. So there may be things that you were able to do to your hair in the past that as you get older, you're not able to do. Same goes for skin, right? When we're younger, we may be able to get away without any moisturizer, but then as we get older, we really got to use the good stuff or else we start to itch or we start to scratch, right? And adhering to a skincare regimen is critically important, much more important than it was when we were 6, right? Than when we're 36, and the same can be said for the hair. I need a whole new hair routine. So what's the best shampoo, conditioner, deep conditioner, you know, protein treatment, everything like that. So, you know, if there was a one size fits all answer to this, I wouldn't need a curly hair boot camp. I would say everybody get this one shampoo, everybody get this conditioner, everybody get this deep conditioner. But guess what? There are different curl patterns. There are different density to the hair. What's most important is identifying the ingredients in these products that are going to be most beneficial, okay? Because again, there's scientific data behind this. And when you understand how ingredients work, then you will be able to apply that knowledge to pick your own shampoo and to pick your own conditioner and your own deep conditioner, and devise the perfect regimen for you, right? So that's one of the main takeaways that you get from this course. And what about this question? So, I've noticed a lot of hair breakage, but I started taking biotin and I've been on it for 6 months and I haven't noticed any improvement. So what's next? I find a lot of my patients do an excellent job of trying to fix the problem before they come and see me, right? Something like hair breakage. They're like, you know what? I searched the web. I found that biotin can help. I'm on it, but like, hey, I'm still here, right? Nothing's getting better. The thing about supplements is they're very tricky. And I have a whole course that goes into supplements and the role of supplements. And one thing that you'll find is that there actually are some supplements that can be helpful depending on your hair issue. But they're very particular. So not every supplement on the market will help. And so it's going to be important to understand just which supplements are going to make the most sense for your hair routine. And then lastly, my hair has been thinning and I've been thinking about trying essential oils, but which is the best one to try? Okay, so I love this question because everyone loves a good essential oil. But I think one of the things that people don't realize is there are certain essential oils that have been shown to be more beneficial than others, right? So instead of spending, tens to hundreds of dollars trying a bunch of essential oils just based off of something that you saw on Instagram or Facebook, why don't we focus on the essential oils that have actually been studied and published in dermatology journals? And why don't we talk about how to incorporate essential oils versus how to incorporate carrier oils? Because they're very different. They have very different places in the healthy hair routine. So we're going to talk about that extensively as well. So you got a sense of a little bit about what this course will offer just by hearing some of those frequently asked questions that I get in my clinic. So what all will you gain from this course? Well, you're going to understand how to take care of your curly hair. And whether you have curly hair or someone you care about has curly hair, you're going to understand it. You're going to have a better grasp on curly hair needs. And in doing so, you're going to be able to choose products that make the most sense for you. So we're getting rid of those days where you buy 10 shampoos and each one of them is used once and then you're stuck with them forever, right? We're also getting rid of those days where you choose a shampoo or conditioner just based on the packaging. We don't need the packaging anymore, right? Because if you take the Curly Hair Bootcamp series, we're turning that package to the back and we're looking at the ingredients, and that's what we care about. We don't care what's on the front, we care what's on the back. And once you're able to do that, you're going to have so much confidence, right? You're going to be able to devise your own healthy hair routine, and you're going to be able to work with your stylist to come up with the best treatments for your hair. You got to remember, most stylists, their job, they want to make you happy. You're their client. They want to see you smile, right? If you go to a stylist and you say, I want you to flat iron my hair, bone straight, they may wince and they may say, oh gosh, I don't know if that's the best thing to do, but they'll do it, right? You have to figure out, how can I help my stylist work the best for me? And you will feel more confident in providing that direction after you complete this course. Now, what this course will not do, this course is not a substitute for medical evaluation by a dermatologist. If you are experiencing severe hair loss and breakage and you're not sure what's going on, you should get a diagnosis. Most of my day is spent treating people with true medical alopecias. And I prescribe a lot of medications that are required to improve the overall appearance of their scalp and their hair. I do procedures as well. This course is not a substitute for that. That being said, here's a success story, right? This is actually one of my patients who was gracious enough to let me use her pictures in this course. This is a wonderful woman who had sought the help of medical specialists for years to understand what was the cause of her hair loss. And you can see on the left here that when she first came, her hair loss was fairly extensive. But again, this is after years of treatments. And when she came and saw me, I took a look at her hair and I took a look at her scalp and I said, look, I have great news for you. I don't see scarring hair loss. I don't see permanent hair loss, but I do see that we can make a lot of tweaks to your hair routine such that you may experience significant regrowth. And when she came back to see me 4 months later, this is what she looked like on the right. Okay. Just 4 months, a single follow-up visit. We didn't do medications. We focused on hair care. And after she had this improvement, she said to me, you know, I wish that somebody had told me that there was so much that I could do at home to help myself. I know that most of my patients, they want the help. They just need the information. And so if you're listening, if you're providing care to patients, this information will be so helpful for you. It'll help you help patients. Okay. And we get to that point that you saw with that patient by adhering to a lot of the things that you're going to learn in this course. You're going to learn about the characteristics of curly hair. You're going to learn about some common causes of hair breakage. You're going to learn about how to develop a personalized hair care routine based on your curl pattern and density. We're going to talk about optimizing the health of your hair, whether it's curly or relaxed. We're going to talk about incorporating supplements and essential oils, if necessary, into your routine. So if this has excited you and you would like to learn more, you can access the full bootcamp course. It is available now. And I am here to help. Right? If you don't want to complete the full course, you actually have access to individual course lectures that you can select and choose to watch just based on your personal preferences. So I hope that this has been helpful. I hope it's been informational. I would love to see you in future bootcamp classes. And if you love any of the tips or suggestions that are being provided, please feel free to comment on those lectures as well. But happy learning. You guys take care. Bye.